This is not a. It is not a very salubrious room. It's not a very grand or dignified room, and I apologize, but it's a room where a lot of work happens. This is where, for our department, where a lot of the work and the decisions happens in here. Well, it is more. The discussion is more important than the room. First of all, it is a great pleasure to welcome you here. I have one colleague with myself today. This is Marcus Stalhofer, and Marcus will introduce himself in 1 minute. Maybe I can take just a few seconds to introduce myself. My name is Dr. Nigel Rollins. I am also a pediatrician. I am originally from Belfast, Northern Ireland, but I trained in Belfast, and then I worked in South Africa for nearly 15 years. And I was Professor of Maternal and Child Health at the University of KwaZulu-Natal in Durban. Much of my work was by necessity. It was focused on HIV and also breastfeeding, and the dilemma about transmission of HIV through breastfeeding against the risk of malnutrition from not breastfeeding. So, coming to WHO, most of my work focuses on nutrition and breastfeeding and young infant and child feeding. Marcus will introduce himself as well, but today Stephen had said that you were interested in some issues around child nutrition, and so we thought that we would focus some of our discussions and share some of our work.
Good morning, everyone. My name is Marcus Stalhofer. Good morning and welcome to WHO. I work for two departments. 50% of my time I work in the department with Nigel, maternal, newborn, child and adolescent health. And the other 50% I work with the department for nutrition, for health and development. And my background is in international human rights law and international relations. So I'm not a medical officer, I'm a technical officer in this organization. And my focus in this department is on trying to integrate human rights standards into the technical work of WHO to improve child and adolescent health, including quality of care, improving quality of care for children by embedding human rights standards and principles into the monitoring, evaluation, as well as design of health services.
是一半一半，一半是和这个就是先生一起工作的，是关于儿童健康，另外一半是关于营养方面。但是它更多的不是关于媒体，而是技术层面的，然后是关于人权的一个双方面一种关联，就是大概这方面，它是50%这面50%。
So I'm not sure whether Stephen or someone would like to say a word about the group. Just Stephen has kindly described a little bit about your visit, but maybe it would be nice just to take 1 minute to hear more about your visit as well.
My name is Zhang Siqi, and I'm the doctor and neonatologist from China and Guangzhou City. Actually, I had a very close relationship with WHO because I got a WHO scholarship 30 years ago, and then I went to United States and for 2 years studied in Salt Lake City and Chicago. Wow. So yeah, so from that time to now, and I just very close to and concerned about WHO's work, and because my special is neonatal nutrition. So, and just Stephen say, and his field, it's very close about it. We concern about the neonatal nutrition, also the children, about the nutrition and the development. Especially now, China is like a developing country, and we grow up, but sometimes the nutrition is really important to affect the baby's future, about their growth, body, and also mental development, and all those problems. So, and we want to focus about like a nutrition and development of our children. And we really want to know like WHO can do something for all like the world children, how to make like the standard for baby to say, and how high the standard nutrition support, not too much or not too low, and then for all the baby they get the body composition healthy. It's not only like a weight or health. So, and we think if we can get some information from there, and it will be very good.
You are making Marcus and myself very, very happy.
Yeah, because I'm also
Very
the
happy.
associated and director of Pediatrician Nutrition Group in the Chinese Medical Association. So every year we had a meeting to discuss how to make the nutrition in China also catch about like all the WHO standard and compare how about our country and with the world. So I think it's very important for here to discussion some the interesting problems.
Maybe what
My name is Yu Huiming. I'm also a neonatologist from the Children's Hospital of Zhejiang University of School of Medicine. So I'm a neonatologist, do a lot of work about the clinical affairs, but nowadays, a lot of premature infants in China, even incidence is increasing. So beside the technology, medical support, so nutrition is very important. So we concern about more and more breastfeeding. But even though we can also have some premature infants not available to receive breastfeeding, but we need some more formula, special formula for premature infants, very rubbers and extra rubbers. And we have also some disease like vomiting, allergy, and food intolerance. So we also in China also need some special formula.
Yeah.
So we are also interested in this field. Thank you very much.
Well, Marcus and I said we are very, this is the area of work that we spend probably 80, 70 or 80% of our time on this type of work, and so we are very excited to have the chance to discuss and to maybe think about how work can develop in the future. So we're very happy. But maybe what we could do, just to take, I mentioned that at the end of August I will be probably in China for a series of for one meeting, and it relates to 2 papers that were published in the Lancet in January on breastfeeding. And I have copies of the papers here for all of you, so we can share those around. And so maybe Marcus, if you could, when you're just a little bit ready. And at the end of August, there will be a meeting in Beijing that will be co-hosted by the Lancet and also by UNICEF, WHO, and the Bill and Melinda Gates Foundation to have a meeting that will share this exact papers and the same presentation that I'm going to share now. So the papers were a collaboration between about 25 different academics and from people from Brazil, North America, Europe, Africa, India, but sadly nobody from China. And I think that this is certainly one point that we are aware of, that we don't have enough collaborations with China. I mentioned briefly that in our department we have a major collaboration. It is almost happening, and it is a collaboration with the Canadian Institutes of Health Research and the National Science Foundation of China. And it is looking at, amongst other things, nutrition in pregnancy and early child nutrition, about the prevention of obesity in children. And this is following the developmental origins of health and disease concept of David Barker. So this is probably the first global map of breastfeeding prevalence. And we can see that there are some countries where there is no data. One of the big messages from this analysis was that the high-income countries have the worst data for breastfeeding practices. We are not sure what is happening in the high-income countries, but for the lower and middle-income countries, we have much better quality of data.
This is the latest report. It's the first report ever produced jointly by WHO, UNICEF and IPFEN, which is the International Baby Food Action Network, an NGO that has been working ever since the beginning of the code on helping countries to expose violations by companies. But equally important is for countries that have strong legislation is to monitor and enforce the legislation. You need to have mechanisms in place to ensure that violations are identified and that violations are corrected, that action is taken against violations, be it in the public setting or be it in the health systems environment. So in conclusion, I mean, it's a big business, as we've seen, in terms of the numbers. It's a very difficult industry to confront in terms of regulating their conduct. But the new network has developed protocols for helping countries to strengthen their legislation and to strengthen their monitoring systems. And there have been already discussions, preliminary discussions, between WHO, UNICEF and the Ministry of Health in China to take part in applying these particular tools or instruments to strengthen China's regulatory framework as well.
So when we talk about breastfeeding as being the benefits of breastfeeding, and we say we set a standard, WHO sets a standard about how much breastfeeding, for how long. That is the standard. Initiate within the first hour, exclusive breastfeeding, introduce complementary feeds, continue breastfeeding for 2 years or more. That is the standard, because all of the evidence supports this to be the best for children. So if you are a family and you have, $20 and you must make choices, if you believe this milk is very good, you will sacrifice for your child. But maybe the truth is that this milk has no added value compared to family foods or cow's milk. But it is the marketing that makes people believe this. And they are ready to sacrifice. So I think this is part of the problem. It means that people can make better choices and to make the comprehensive nutrition for their child can be much better. And then the outcome is better short-term health and long-term health.
Dr. John, it's very nice to meet you. I know you've been in Geneva today.
Yes.
Can you tell us in a few words, how did you like Geneva?
Oh, that would be a wonderful city here, you know. And it's the second time I be here, but I never be here like a national and united. But I saw the beautiful signs and so lovely persons. Everything is so perfect, and I think that the people will be very good culture, and they had a very good education, and I will love this city forever.
Thank you very much.